I just want to say a few words as far as what my desire to be part of this here is that I spent my life treating patients with lung cancer, but I really savor the opportunity to get some feedback and to learn all the other things that go around. I see a patient in the clinic and I give them news like you've had, and there are so many reverberations and so many, you drop the stone in the pool and it radiates out. It affects so many people, family, friends, supportive people, and there's so many different ways of looking at it. I don't mean to be insensitive. I'm thinking I just am blind to things. I do the best I can and try to listen, but it's a chance to get some feedback. And I'm head of the cancer program at the largest cancer center in Atlantic Canada, and I'm interested in, for all cancers even, about how the system works and what you see as somebody who's been touched by cancer personally, how things are good and how they, it's good to know how things are good because we're going to do more of it, and it's good to know how things could be improved or where there are blind spots that I admit I've got blind spots. People with cancer, you're the experts on it. You know about it more than anybody does. And if you've got a family member with cancer, you know about it more than I do. I know about the biology of it, but there are all sorts of other aspects. We're human. We're not just biologic bits of DNA. There's the emotions and the social side and the family side. So we've got some categories here just to sort of guide the discussion, and maybe you can just give me your impressions on things and see where we can what we can get from this. And so, pre-diagnosis. What symptoms did you experience that led to your diagnosis? No symptoms. Right. No symptoms. And your brother?
Zero.
No symptoms. So.
I mean, I had general fatigue, but I've always been fatigued. I've always needed a nap every day.
But nothing too specific.
But nothing like
no
shortness of breath, no cough, nothing like that. It was literally I had a little nose that just kind of popped up, and it was completely benign.
So that's that was benign. Oh, I see.
Anything.
Oh my golly, that's sometimes what happens in getting early stage lung cancers. But certainly it points to your suggestion that we institute screening for lung cancer. I mean, there's screening for breast cancer, screening for prostate cancer. Why not screening for lung cancer? We know that, the earlier stage the better, so why not? Because by the time you feel it, it's often quite advanced. So,
Right now, detection is a crapshoot.
yes.
It's just a crapshoot.
Yep.
If you get lucky, it's early. Others,
Yeah, I mean, I went from being a stage 1 with a 2.2 centimeter tumor in my lung to being 3A in like an hour. They went in and they found that the nodes around the tumor site were positive. So,
Who did the surgery?
Joseph Combo.
Yeah. Yeah, he's a nice guy. I know him. Yeah. Yeah. That's.
I know Bill's was discovered. Bill had food poisoning, ended up in the emergency one night, and they were concerned that he had swallowed a bone, so they did a chest X-ray.
Yeah. Well, it's often they're found incidentally for other reasons. Do you have previous experience with the healthcare system?
No.
No.
But that was as a supporter and things. He was diagnosed with terminal mesothelioma, so there was really nothing they could do for him. But they were very good in terms of palliation. At the time, I think they were good with palliation. We had a home care nurse come and take care of him.
Yeah.
He did have a lot of pain that had to be managed.
Bad cancer, and it's hard to manage it. It's it doesn't respond too well to radiotherapy or anything.
Pretty not nice.
What was yes?
In response to your question about the healthcare system, I did have the advantage that my father-in-law is a doctor, brother-in-law is a doctor, 2 nurses on my wife's side. My wife was with the family kind of thing, so I had an awareness of how the system worked and everything else, but I never interfaced with it beyond my family knowledge.
Did it get you through the system faster?
No,
You just
no,
lucky,
no,
as you said.
absolutely not. No, I was in the right place at the right time. Dr. Johnson saw my results and away I went.
Can I make a comment?
Yes.
I think if you know somebody in the healthcare system, you'll get through it. Unless you got a good family doctor, who will do it for you. But it's amazing how that helps if you know somebody and they just guide you through it. And I guess one of the things that I would make is that I think cancer, lung cancer, needs a navigator. Somebody to advocate for it. I mean, breast cancer has a navigator, and I think we need a navigator to help us when you get it.
So what do you guys think about navigators?
I think I liked your comment about being your own advocate. I know at the time when our brother was diagnosed, it was such a devastating thing to hear at first, but immediately when we found out that the wait time in Newfoundland was so long, I said, no, that's not good enough. It's just not. So I got on the phone, and I know when Dr. Hempelef finally spoke to my brother, he said, would you like me to call your sister Kathleen, or will you call her? Because I had Dr. Hempelef drove crazy. Please see my brother, please see my brother, please see my brother.
I agree with you, by the way.
It's one thing to be your own advocate because you want to, and I mean, that's my personality, but I know there are lots of patients that aren't. It's too devastating for them, so
Yeah.
they get told they've got cancer.
Unless you have a good system.
Exactly. So, I mean, really, there should be someone that's been medically trained that can address some of your concerns and say, you know what, that is normal. Let's look into it. Or here's, this is your next course of action, and take information. I mean, I was not too informed, but that's just being young and knowing what lung cancer does because I've seen it in my father, and I knew that it was not good. That I mean, it was basically like being a cat backed against the wall, and I was just clawing and fighting for my life. So that's what I did.
Most people can't.
Exactly. Most people may not be
If
able
you're
to.
educated, you're assertive, or you know somebody, then you can advocate for yourself. But if you're, I won't use the word average, but if you don't know your way around or you're relatively uneducated, you're a dream.
So just to think about this, you see a surgeon and a medical oncologist and somebody to test for molecular testing and a nurse to give you chemotherapy. You get side effects from chemotherapy. So, like the idea of a navigator, is that a helpful concept?
so.
Do you find that there's so many different parts to this puzzle that you have one person you can go
If
to?
I wasn't organized, I wouldn't have, literally, I wouldn't know what the heck I was doing.
You seem to be very organized and assertive, and not
You're really
everybody is
exceptional.
organized or assertive.
Can I say that I think you need two people. I think the navigator gets you through the system. Unless you have a good family doctor who says, I know who to contact, and I know that this surgeon is responsive, and when I tell them that, I think this is cancer, they will respond, and a lot of GPs won't do that. If you get to the navigator and the navigator reviews some of the information and says, I'm going to go to Dr. Bethune because I know he'll step on this very quickly, and nobody else would know that, unless you're in the system. You don't know which buttons to push, and I would argue that with most cancers,
Yes, and that's-
particularly small cell, you got to be very quick.
You got to be quick. And in fact, you're right, unless you're in the system. And I was lucky. I was in
You
the
were
system
lucky, yeah,
because I was in the study.
Yes.
but you're lucky. You got horseshoes.
I wasn't starting with a GP who was going to schedule me for an X-ray, who would then get the X-ray results, and then try and get me a CT scan, and because there's protocols on whether a GP can get a CT scan for this or that and stuff.
I mean, I've had a lot of friends, and they're all subsequently young adults, but a lot of them have experienced delayed diagnosis because they're young. And, you wouldn't have colon cancer because colon cancer affects people that are 65 plus, and you're 25. So why would it be that? You have rectal bleeding? It's okay, it's probably a hemorrhoid. And so they've been sent away. Or, it's depression, you don't have lymphoma, it's depression. And so, they've experienced delayed diagnosis to the point where they were extremely sick and intervention had to happen or they would die. And so, if you have a diligent GP, then that's wonderful. And I'm lucky because my guy said, hey, you know what, let's just figure it out and we'll send you for a CT. It's no big deal.
You had a very good doctor.
Yeah,
Sounds
I
good.
sent him a fruit basket.
But one of the things that you pointed out is that the number of young adults with lung cancer is 7 times the number of pediatric cancers. Not with lung cancer, but with cancer. And I think that's a very important comment. And I think young adults with cancer are often underdiagnosed and missed and delayed diagnosis because
And unfortunately, there's no research to support that. They tend to find that young adults with cancer, their tumors are a bit different than older adults with cancer.
Yeah.
And so they respond differently to medications. And
Yeah.
so there's a lack of research, there's just a lack. And so, I found myself in a unique position of being both a lung cancer patient, which is a rarity, and a young adult cancer patient, which
Yeah.
is also.
well, that's a really interesting observation because huge resources are dedicated to pediatric cancers, huge, and essentially nothing focusing on young adults with cancer. That segment is not recognized at all.
And what they've just found is that a lot of the childhood survivors of cancer are getting secondary cancers. And so they find themselves in a position of being 20 or 25 or
Yep.
30, and now they're getting secondary or tertiary
Yep.
cancers from the treatment they received as a child. So, yeah, it's definitely
That's a very
an area that needs to be kind of.
Can I just finish? I said that there were
Absolutely.
two people, but I
Yeah.
think I've convinced everybody you need a navigator, which I really believe in, which would have helped,
yes. Who was the
a lot
second
of people.
one?
The second one is a support person. I don't know if in Nova Scotia we have a support group for cancer survivors, which I think would be a very useful thing. You've gone through cancer, and your whole life has just been turned upside down, and I can't think of any greater time when one needs support to carry through that. We have support groups for COPD. I think cancer would be even more important to have a group. Now, there are some cancer groups, but I don't know if there's one specific for lung cancer. But there are, I know the Cancer Society has a number of groups which come and go in various places.
But at the same time, I think supporters also need a support group, and there's a real lack.
Supporters,
If
family
lung
needs a
cancer
support
is
group.
sort of the lack of support for the patients, then for supporters it's even worse, because I've been on both sides of the fence, and being a supporter, you're kind of watching helplessly as your loved one is going through this, and you wish you could do
It's the
more, and you
people
want
around
to do
you.
more, but
My brother made that comment to me,
Yeah.
I remember on the phone one evening. He said, "How are you feeling?" And I said, "I'm fine." I said, "How are you?" And he said, "Do you know what?" He said, "I feel sorry for you guys." And I said, "No, why do you say that?" He said, "Because I know what I have to do," he said. "You guys must feel sorry for us."
yeah.
Yeah, exactly.
I thought that was so profound for someone who has cancer to say.
Well,
that
one of
he knew what
my
he had to do.
one of my greatest fears being re-diagnosed with stage 4 cancer and facing death and thinking, oh my gosh, having watched my father go through what he went through, especially right at the end of his life, I thought, oh my God, I have to put my mother through this again. And really, it was more of not as much going through it as a patient and suffering as a patient, but having my family have to go through that all over again was horrifying to me. I would sooner jump off a bridge. Yeah.
I just want to go back to both your suggestions. The first one about the navigator. An acquaintance of mine in New Glasgow, she's roughly my age, and her husband came down with cancer. Actually, it was quite late, liver, pancreas, everything else. She was a non-educated woman, and she was on her own with her husband, just the two of them. And she absolutely relied on the cancer navigator at the Aberdeen Hospital.
Great navigator you have there.
Yes. Not only in terms of the sort of inserting into the system, but even basic things like arranging transportation, because she couldn't drive, to get up to Halifax for various tests and chemo and so on. So she would have been lost because she's alone. And there are a lot of people in our society now, because we're so mobile, they're alone. You two are there for your brother, but your next door neighbor.
No, I think there would be great community support as well if we asked individuals, will you be available to drive somebody who has cancer to their treatments? I do that in a heartbeat.
Yeah.
The Cancer Society does. I don't
Yeah.
know how
right.
extensive it is in other provinces. I know they do it definitely in Ontario. But if you need someone to pick you up and bring you to your treatment, that they absolutely will do it. Yeah.
So navigator and family support group.
Yep.
Not quite as much for the victim, really.
don't
Because
think?
you
I
have to
think the
deal with
victim-
that internally. You have to deal with it. And yes, you want to be able to talk to some people about it, but the people around you have to deal with it and what's going on.
I don't know.
And-
I think facing your mortality at 30 or at
Yep.
any age, I think,
It's hard.
is really hard. I think that it would be good to have. I'm lucky enough that there is a lung cancer group at Wellspring now. How old or how many people are there that will identify with my own needs. I don't know, because they probably, and I'm going to make the assumption that they'll be older, they probably have a history of smoking, maybe not, and so I don't know that I necessarily identify with them as much as I would identify with the young adult group, which I have taken
So is
part
the
in.
young adult group with different cancers probably better than a lung cancer only group
Yes,
for you?
for me personally, yes. Yeah.
Yeah. That's really...
And here, I don't know how, I should ask my wife, because she was a social worker and she actually led the cancer groups. And I don't know how well it's working. It's my understanding that when she left, that it may not be continuing, but there is a cancer group with all different types of cancers that come together and talk. You don't have to come, it's available there, and they talk about various issues and have, I think they even had Dr. Bethune over to talk one time and stuff like that. So I think those, if it's small, lung cancer could be included in that group because the issues are somewhat the same. It's to say, can we talk about mortality and how are we coping with it? Yeah, and some people are lucky because they have a partner who is very supportive. There are maybe other people that don't, or maybe don't have the wherewithal to help that person. And so I think these support groups would be very helpful for those individuals. It's a lonely time for some people.
Absolutely.
But even though we're talking about lung cancer, cancer is cancer.
Cancer in general. I think.
And so rather than coming up with a whole bunch of little stovepipes for different kinds of cancers, there's some applications where just a cancer support group,
Yeah.
particularly if you're looking at terminal cancer.
Yeah, I think that I know, I was going to say that in some of the conferences and various events I've been in, people tend to get shuffled into, well, you're sick and you're in treatment and you're dying, or you have been cured and you're a survivor. But there's nothing for the people that are kind of in that gray area. And again, I find myself in this gray area, and so they don't have anything for people that are living with, advanced disease or someone that's living with a terminal diagnosis.
There's going to be a lot more of that. There are new treatments. We're going to turn cancer into a chronic disease. Like
Exactly.
some people live
I hate the
years
word
HIV
survivor. I hate
positive,
it.
They just live with different treatments. So that's where we're going to be with a lot of cancers, not just a black and white cure, but we have people who, with varying treatment combinations, live for years and years and years.
Yeah.
So that's a very, very good topic.
I was also thinking about you were talking about your wife being a social worker. She was trained to deal with sort of larger societal issues and sort of mediate and facilitate. I'm also thinking that because there are a limited number of supply of professionally trained people to do these things, having a patient or a former patient as sort of like but it's almost the same idea as the Immerman's Angels. If you have someone that's navigated the system before and they are willing to speak to patients that are newly diagnosed, or help them to even just, oh my gosh, I'm having these symptoms and I don't know, is this a normal thing, or, is this a side effect or what? Having that person that's gone through it say, you know what, yeah, that happened to me, like my hair started falling out 2 weeks after chemo, like things like that are so useful, because like really, it's hard to talk to a partner or your family about stuff like that because they don't know, and you can't always get your doctor or your nurse, so having someone...
But I want to go back a step. You don't want the doctor, the nurse. The person who has lung cancer is the expert on lung cancer.
Absolutely.
Or the expert on what it feels like to have lung cancer. The doctor's not, the nurse isn't. The person who has it is. So those questions about what it feels like to have lung cancer, what the side effects of the treatment are, the person who's had it is the best person to talk to about that.
And what's going on in your head.
And,
Talk about what's going on in your head.
And if you can share that same experience with somebody, I would think it would be very, very
Yes.
helpful.
You're making the case for a lung cancer support group then,
Yeah.
specifically.
Yep, I am.
It took me 3 years to meet one survivor. 3 years. From the time I was diagnosed
Lung cancer?
to this year, I met a group of women through Lung Cancer Canada, and it was the first time I'd ever met
There's only
another
2 million people
Lung
in
Cancer
Toronto.
Canada.
There's only 2 million people.
It's true.
And you
And
only met one.
we're a rarity. I met 5 actually.
Did you?
I did. It was amazing.
So why are we not better off in organizing lung cancer advocacy groups?
I think because there aren't I think again, I think it comes down to the public awareness. I think it comes down to the fact that it is a stigmatized disease. In no other disease do you blame the victim. And I hate calling myself a victim. I'm not a victim.
Yeah,
But
and it's heart disease.
yeah, heart disease is
Smoking.
lifestyle. Exactly.
You're getting your knee replaced. Most people are overweight.
No
Have
one
that
blames them.
done.
no one says, "Hey, you had that piece of chicken. You shouldn't have had it."
Diabetes. 50% of colon cancer is lifestyle, so it's not fair.
I think it's less because of stigma. I make the point is, up until recently, the mortality's been so high.
I was going to say that was the second thing. There are not
Yeah.
enough of us to
Yeah.
say, "Hey,
Yeah.
we've survived this." Rah rah.
Well, there's a group that have a very small nodule picked up on a screening, and you do a minimally invasive, you take out the tumor, and that's it. They're gone, and they're not coming back for different treatments. And often those patients could be really good advocates, but they're just voted
But I think you made the point that people with lung cancer are living longer.
Yeah.
That potential's even more so today than it
Yes,
was
it is.
yesterday. And
It's
so
gonna
I think
change
we
things.
have to start to prepare things.
Yeah.
I think we have an opportunity now to say, because those people are going to be sticking around for a while. They can relate to what they went through. I mean,
It's
you guys
interesting,
are
I've
examples
been
at this
working
table.
in the trenches for years, and you take a step back and you realize there's a lot of neat stuff happening right now, and it's the screening, targeted therapy, and new radiotherapy techniques. There's a lot of stuff happening.
Lung Cancer Canada just released they conducted a survey, I guess nationally, and they got different public opinions and funding statistics. And so I think they get 7 cents for every dollar for funding.
Yeah.
Maybe less. And so for me, that's amazing to know that even with the lack of funding available, that we've been able to develop better targeted
Yep.
radiotherapy, better detection. The fact that they found, the ALK mutation, the KRAS, all of those, and developed a targeted treatment to combat it, it boggles my mind with that. Abysmal amount of funding. When you look at it on a per
It's
person,
amazing,
it
yeah.
is really amazing that that's what's been able to happen. And it really is I can't imagine what it's like to be a physician seeing all your patients die because there's no progress made. So that must be ridiculously frustrating, and just you have to be passionate about it, or else you just throw your hands up in the air and say, I don't want to do this anymore.
Well,
I can't do anything.
It's finally things are happening, and it's great.
Yeah.
15 minutes.
15 minutes, okay. So we've gone off our schedule a little bit, but well, we've covered
These are
pre-diagnosis.
more important questions. So whoever put these questions down,
Yeah,
get the right.
yeah. Let's get the right.
Post-diagnosis, the support group seems to be really important. The navigator seems to be important.
I think the continuity of support. I found that during treatment, I had access to my medical team a lot more frequently. And so if something was coming up, I could ask them. As soon as it was over, where I wasn't in, active treatment, where I was just being monitored, it was every 3 months I'd get to see my doctor, and I'd be able to kind of, vomit out all the stuff I've been feeling. And it's like you said, when you were going through treatment, you have a job to do. You need to go to the hospital, you need to do this, you need to do that, and sometimes you're tired and you can't drag your butt out of bed. And so you're so fixated on just getting through it that the actual gravity of what's happened to you doesn't hit you until later. 6 months after my last treatment was when I became crippled with anger and depression. And I expected it. I thought it was going to happen, and I was waiting for it to happen, but it
How
didn't
did you
hit.
know this was going to happen?
I had experienced depression before, and so I was just waiting for that sort of that sadness and lack of motivation to do anything. I was waiting for that, and it didn't come to me like that. It came to me in anger. I would snap, and of course,
It's well described. That's why I'm asking. Why did you expect it? I'm impressed that you knew it was coming.
I
So you
just
can prepare a little
figured.
bit
I
for it.
figured it was coming, and so I was seeing a psychologist. I was trying to be proactive about it. I talked about it. I wasn't, I didn't try to bottle it up, but it just came out of me in rage, and it was unfortunately directed to the people that I was closest to and that had taken care of me, and it was literally I was physically going to hurt them, and I was like, well, this is totally not right, and there's something wrong here. I need to see my doctor.
And you're normal. You know
And
that
I'm normal.
You're
I'm normal.
No, you're normal. Actually, I think that's a common phenomenon, and some people experience it in greater depth, and others minimize it, and maybe for all kinds of different reasons. But it's something you have to expect. It's not when you're going through it, like you said.
Yeah, it hits you after, and it hits you like a bus. And so, I mean, I experienced the whole thing you were saying, the whole scan anxiety. I hated it. I'd go in for my scans, and I'd have to wait 2 weeks for my results. And like those 2 weeks were like, I was catatonic.
That's something that the cancer system has to improve. I think we should, I mean, we've got to find a better way to do that.
I read an article by the guy, Bowen, I think his name was. He was head of the American ACCP, American College of Chest Physicians, and he had metastatic kidney cancer or something. He wrote about his experience, and he said,
"Oh, Roger Bone, you're right."
Yeah, Roger Bone. He said, and I've never forgotten this. He said the worst thing was
Waiting
for his results,
Not knowing.
Not knowing.
And often I get people saying, well, you've got to tell people at the right time, the perfect time. And I said the perfect time is as soon as possible.
Yep.
Sometimes I'll
Absolutely.
call people and
I
say, look,
went through-
here's the
Slow.
result, because I know you're waiting. And if it's a normal result, I call them and say, look, it's normal. I just want you to know. I don't want you to wait another day.
My scan started showing abnormalities in July of 2010, and it wasn't until May of 2011 that they actually confirmed that it was a recurrence. And so every time I went back, they kept saying, oh, it's probably nothing, it's scarring, like they go through it with a fine-tooth comb, yada yada. In February, I'd had enough because I was literally vomiting. I was so nervous, and I was just waiting for the other shoe to drop. I mean, I knew my margins were positive, so I always knew it could come back, and so I said, I need to know. I can't
And
live
especially
with
for
not
cancer
knowing.
patients, I think we have to find a better way and faster way. Like, if you see a patient and you want them to go to chemotherapy, there's a delay.
Well, we've got the internet, we've got the web. Why don't we use it as doctors? We don't use it between each other for medical issues. We don't use it with patients. And I don't see why we can't do that. I think that's what we should be doing.
Guys, if I could just interject, it's fascinating listening, and I wish we could listen all day. There's one question that we really would like your thoughts on, and that is, if you had one piece of advice, because we're going to have to run
Yep.
in 8 minutes. If you had one piece of advice to improve the lung cancer journey issue, one thing that you'd give us to kind of help us maybe put a little focus to this, what would it be? And going forward, we're going to need to engage people. We need to put a face to this issue. We need to spread our reach to get more people involved. And what do you think the best way to do that is, and how would you like to be involved? Just to give us a bit of a sense.
It's 3 questions. Is he allowed 3 questions?
One piece of advice on how to make it that you give us to make things better, and how would you like to be involved going forward? And I'll leave that with you.
Being a family member of someone with cancer, and starting this journey over for a second time, I'd like to hear more success stories like yours. Everything is very negative. Stage 4, that there is everything, all the research that you do is very negative. We need to hear more of the success stories. We need to hear more of the work like you're doing, and the success stories that you're having, because it is very bleak right now.
Well, it's a bad cancer still, but we're making some progress.
Yeah, absolutely, yes, and not unwarranted.
No.
There needs to be
Yeah.
straightforward facts, but we need to hear more of the success stories from a family point of view.
Yeah.
This is my thought.
Me? Detect, detect, detect. Detect. If you don't find it, you can't fix it. And we are terrible at detecting it. We detect it when somebody is at stage 4. Like, how the hell did he go from stage 1 or 2 to stage 4?
Yeah.
And nobody noticed. How the hell did that happen?
Absolutely.
Detect.
And I think we've already answered one of the most important things is that time from when you're scanned to when you find out that has to be reduced. Because it's not only hard on you as the patient, it's brutal on families.
Yep.
We're trying to function daily, go to our jobs normally, and it's tough. It's tough to have to wait.
I think we need to change the perception that, this is a cancer caused by X. I think if you have lungs, you can get lung cancer, and that's what we need to look at, and that's what we need to say is that, doesn't matter what you've done, doesn't matter what you've been exposed to, if you have lungs, you can get lung cancer.
The first question at my workplace from everybody.
Did he smoke?
Yeah.
Yep, get it all the time.
Question.
All the time.
Like, who knew that 25% of lung cancer people are non-smokers? I didn't know that. That's
Actually,
pretty
if you
basic
add
information.
former smokers, it's almost 55%.
Yeah. Oh, yeah, and I'm a
Yeah.
former smoker, but
You were a
25% never smoked. Who knew? I mean, that is really basic stuff.
Yeah.
And you go on TV and say, hey, everybody, did you know that 25% of lung
Yeah,
cancer people
that's right.
never smoked in their lives?
Yeah.
And oh, by the way, more of them are dying than all the rest of these other things that people are getting all kinds of money for.
There's
Yeah.
a phenomenal advertisement campaign out of the States. It's the LCA. And they have posters, and they postered everywhere that said, you know, cat lovers deserve to die, and smuggled ants deserve to die. And the whole premise was if they have lung cancer. And it's just an in-your-face
it's a
thing that
perception.
says, you know, that's the perception of what it is. But really, in truth, no one deserves to die. And I think it's one of those things that really does impede public sympathy and donation and, you know, the motivation to support someone with lung
Yeah.
cancer. Because, oh, well, you did it to yourself, Doug. You know, you should be ashamed,
Yeah.
ashamed
Yeah.
of yourself.
Yeah.
I mean, you know, it's
Self-inflicted.
and it's not. It could it have been
If
your
I was drunk as a skunk speeding at 180 miles an hour and
Yeah.
crashed to kill myself, we'd all be sorry for me.
Yeah, exactly.
And
You're talking on your
we're
cell phone and getting hit
spending
by a
lot of
car,
money,
but
and a lot of money for research about car accidents and how to do our trauma system better.
So,
it's true.
so I'm cognizant of the time. So you've named 5 things here. One, success stories. Now remember what we were asked to do. Come up with what we think is the one single thing that should change.
Piece of advice.
One is success stories. One is a navigator. One is a support group. One is quicker information.
Detection.
Well, and the other detection is another one, and change the perception of lung cancer. So if you had to choose one of those that you could do, for instance, detection, I think I agree with you, but research is going to have to do that. I mean, we can't
Research
change
or
that.
testing?
Or
I'd rather
research.
testing.
Well, no, I think research has to demonstrate that, whether it's worthwhile doing CT scans regularly, et cetera, and who you can do them on. There's present research going on for that. So I would eliminate that one, although I think that's really integral, but that's not something we're going to change. So of those other things,
Well, the detection does need to be up there because there's some research now that's
is that the
shown-
most important thing? That's what we were asked. If we could do one thing,
To
what
Doug
would
it
you
is.
do?
To me, it is.
So you would say that's one.
I would say detect, detect,
yeah.
detect.
To,
Yep.
to my brother, it would have been.
Is that the most important thing?
If
Yeah,
they
it is.
detect it early, you live.
In
If
my
they
mind,
detect
it
it
is
late,
too.
you die. That's,
But how do you detect when you have no symptoms and you're not a smoker?
Exactly. You're going to do
Not gonna
CTs on
work.
everybody?
No.
It's not going to work.
No.
no.
You have to change the perception of what people think lung cancer is and who can get it before you even have, or based on my family history, I should have been having a CT because I've lost my grandmother, my grandfather, an uncle on my father's side, and my father.
No, actually, what your point is more important than anything because we can't have detection happening if we don't have an awareness of the importance of lung cancer. So I guess that's the first
People
thing.
still think the number one killer of all women is breast cancer, and it's not. It's lung cancer. And it's not a women's
It-
health issue, and that drives me
Well,
insane.
lung cancer is a women's health issue.
Of course it is.
And you know, not that long ago, there were cigarette ads in all the women's magazines, and you know, how to make yourself healthier, go to a spa or something, and they've got a cigarette ad in the back page. It just makes me sick. And I was at the forefront of, I was head of the anti-smoking group here years ago, and it just makes me sick.
So can I just make a point? Although I suggested navigator and support group, I think the most important thing is more timely results. That's something that we can change, and I think that's. Although I think all of these things are important, by the way, and in fact, if you want,
I'm
I'd
with
say
that too, that's why.
I'd say give them all 5
Give them
and
all
say,
five,
yeah.
Yeah, there's no magic.
We
bullet.
couldn't rank
Yeah.
these.
No, there's no silver
And
bullet.
these things are the most important things,
right.
and I think there's some you can work on. I don't
Yep.
think you can work on early detection because we don't have enough information yet. I agree with you. I think it's the most important thing to do, but I don't know who to test.
I know, that's a huge problem.
I don't know who to
And,
test
it's,
now.
and it involves money.
I used to know,
It's all about the money.
but I don't know now.
The squeaky wheel gets the grease.
Well, it's not
all-
only that, there's risk to when I test you, right? If, I test you and we find all those nodules, and if we realize that 90% of them are benign, I've just scared the living daylights out of them. I've made you go through trauma, unnecessarily so. So there's downsides to early detection of certain things. We haven't come up with the right tools yet to detect, right? So I think that's a black box at the moment. We're making inroads to it. I mean, the CT scans now have made, but we still don't know who we should test.
Wait till you hear Michael Johnson's talk, because there's research that we've done in Canada that shows it works in the right group, and they've detected the group.
The right group.
It's done. There's research that shows that now.
Did that come out of ASCO this year? I think it did.
There is
don't
a
know.
study that was released just
No, the
recently.
American one isn't as good as ours.
Okay.
Ours
good.
is better.
There is a recent study though that suggests.
I don't disagree with you about the time between having a particular test and getting the results. I mean, that's an agonizing time.
I think it's
And even
terrible.
the time, it's even agonizing to know you're getting tested in a week, like every day of that week before.
But I think that part of that is the anxiety that we're dealing with mentally, and knowing. So here's the thing: before I knew my cancer was back, the worst thing that could have happened to me was the cancer coming back.
Yep.
Well, now the worst thing that can happen to me is I'm going to drop dead. So
Yep.
that, I guess, that perception changes once something happens, but that doesn't make the anxiety any less.
Oh, no, it doesn't.
So I mean, it's a real thing.
Yep, yep.
It goes along with modern medicine. If we didn't have CAT scans, we wouldn't have anxiety about them, but it's a good thing we've got CAT scans.
I go through them every 6 weeks now, so I don't
By
even
the
think
way,
about them.
we've just one last thing we need to finish off, and that is, how would you like to be involved is the last thing. Or how could you be involved, or how do you think you could be involved, I guess?
I would be willing to do anything in my community, volunteer-wise. That would be something I would.
I don't mind talking to groups or being involved as part of, I won't say support group, support team. Like I live in New Glasgow. I'm sure there are people who are coming up with lung cancer in New Glasgow. You know, and if they want somebody to talk to, give me a call. But that database has to be developed. And that takes you back to the cancer management teams, because you guys know who's got the cancer and where they are. So you've got, I don't mean you personally, but the cancer care team has to aggressively reach out to people like us, as was done for this conference, and say, hey, this is going on, or this person needs somebody to talk to, or, you know, come and do this
put us
for us.
together,
Because if you
exactly.
call me up and ask me, I'll do it. If you don't call me and ask me, I'll have another cup of coffee and
I
a
agree.
newspaper.
For me, it's really important, and I feel like I'm contributing by being a patient sort of advocate and telling my own story in whatever form it is. You know what I mean? Like if my scans weren't clear, I tell you my scans aren't clear. But it's really important for me to be able to be a face that someone can say, oh, okay, there's hope. They're not gonna, you know, I don't look at the 5-year survival rate. I don't look at that, because I think about it. I'm like, well, I've been alive, I've survived now almost 4 years. So does that mean I have a year left? I don't look at it like that, because you just get consumed with it. It's not, you know. So for me, it's being a patient advocate and doing stuff like this and getting involved. I'm involved. I signed up to Women's Angels, and so I'm still waiting for a phone call. But I mean, it's always there. So like to be someone that someone can reach out and say, hey, you know, I also have this. How did you cope?
Well, I think we've run out of time. Thank you. That brings up something to me, that as a patient, feeling a sense of wanting to make things better, maybe a sense of responsibility as a beneficiary of all the research that's been done to try to move things ahead. And we really appreciate your coming here, and I have learned a lot from everybody. So thank you very much, and I guess we need to
Thank you.
present our wrap up.
Wrap up, that's the way we go.